right, welcome. We're going to start up in just a couple minutes. So I'm going to walk you through a little bit. We got some people here in the office, some of my favorite people, and online we've got a few people. What we're going to do is occasionally I'll be reaching down here and be clicking on this little guy, and that'll allow you online to see things, the screen more up close, or maybe the screen, if it works, there we go, the screen entirely without me at all. Sometimes you'll see me a little more up close. So that'll give you an opportunity to see things even if you're on a small little device. All right, so I think it's time to start. Tonight we're going to talk about headaches, migraines, which is the one of the most miserable forms of headache. And you know, if you've got them or you know somebody who has them, you know that they can make your life miserable. They change your life in so many ways. But what I like to do is to help people eliminate them, and that can change your life in so many ways for the better. So let's figure that out. Tonight I'm going to give you a lot of how-tos, some things you can do on your own for sure, some ways you can think about the headaches and what may be causing them, and what action steps you can take depending on what the cause is. So really, nerve irritation is what causes them. I'm going to give you a close-up here. Nerve irritation causes your symptoms. So this is the image of a nerve and chemicals causing the irritation, because really chemical or nerves react chemically. They can be stimulated by mechanoreception, which is physical. We'll talk about different things that can cause them. But really there's migraines is typically a chemical reaction on the nerves. That's the last step anyway. There's steps that come before that. And that's why medications try to manipulate the chemicals in your brain to help things work better. And sometimes it does. But if we can get back to the cause, then you don't need to have that chemical intervention. Because these nerve irritation and brain disturbance is what's going on. And that interferes with your clarity, energy, head and arm, low back, leg pain. It can cause all these problems. But headaches is what we're talking about tonight. So pain, it's pain. The nociception is a fancy word for pain at its receptor site. So when your body doesn't actually experience pain, your brain experiences pain. That seems like just a weird little semantic statement, but there are not pain receptors, there are nociceptors. And so some people, not everybody experiences pain with the same stimulus. That's how there's a couple things, there's several things that add up to pain in your brain. And so we'll get to the causes of what those are. Toxicity, local via tension. Tension in muscles causes waste products to build up. Tingling, that can be like a referred sensation. People may feel that in their head, a fullness or a tingling. Brain fog, and injury susceptibility. You're more likely to have other conditions that come on if you have the susceptibility of this nerve irritation and brain disturbances. And natural solutions require a holistic evaluation. So what does holistic mean? You can spell it different ways. There's the W-H-O-L or the H-O-L. I kind of like the W-H-O-L because it reminds you that it's the whole thing, holistic. So when we're looking for holistic solutions, we're looking for physical, chemical, and mental. We're looking for what you eat, drink, breathe, how you think, sleep, and move. All of that plays a role. So the body works as a unit, physically, chemically, and neurologically, or mentally, emotionally. And finding the cause and the right combination is key to solutions. This is a little lock requiring combination. It helps us to remember that you are individual, and we have to find the right combination for you to unlock health and wellness in you. Migraines and other headaches, they have multiple different causes. So rebound is actually one of the most common, and that's when actually medications that should be helping you are actually causing your headaches. That's pretty miserable, and it's one of the most common causes. Ergonomics, which is your workplace, muscles, joints, neck curve, mental stress, nutrition, all that contributes to nerve irritation and migraines. So what's important to you? When you think about, so some of this, and often I'll tell people when they come in to see me, especially if they have a long-term systemic condition. I'm like, all right, are you ready for some hard work? Because I don't have just one pill that's going to fix you. This is teamwork where we help you restore, change your lifestyle, sometimes change your diet, find deficiencies, toxicities, all these issues, and then we help you heal from the inside out. And that's more long-term and more effective. And the side effects, there actually are side effects with our treatment. Side effects like better sleep and more energy. So we like those kind of side effects. So what are you here for? What do you want, or what do you hope to learn? And so is it you just want to stay active? You want to do, I love staying active, right? I love surfing and rock climbing, hanging out with my family, stay independent. So especially as people get older, they're like, you know what, I just don't want to be a burden on other people. Stay comfortable or out of pain. Yeah, migraines can be so debilitating. And perhaps improve or save the life of someone you love. So if it's not you, maybe it's somebody you know. It's like, oh man, how much better would their life be if they didn't have these migraines once a week or twice a week or once a month? So, all right, so who am I? So family chiropractor since 1996 or 95, depending on when we start counting. So that's about 30 years now. Focus on nervous system and chronic health issues. That's always what I've been interested in. And that's how we get back to this migraine because it involves your nervous system for sure. Chiropractic Neurology, board certified annually since 2007. That's where we use the nervous system to help your body recover. So there's medical neurologists and there's chiropractic neurologists. A medical neurologist is going to learn all about the nervous system, the brain, the peripheral nerves, the autonomic nervous system. They know so much about the nervous system. And then what do they do to help you get better? What do they do? This is participation time. So if you see a medical neurologist, what are their solutions going to be for headaches?
Medication.
It's going to be medication, almost always, right? And if you've got a tumor, then they may do surgery or recommend surgery. They're going to do some special imaging. And that's great. You want to have somebody who can really find all those really scary things or rule them out and go, no, you don't have any scary things. So as a chiropractic neurologist, don't do drugs, don't do surgery, so what do? Well, we look for more subtle causes, again, looking for the causes and go, okay, what is contributing to that nerve irritation, causing you to reach that threshold where you then have this terrible suffering called a migraine? And so we also use functional medicine for that. That's where we look for lab testing, deficiencies, toxicities, food sensitivities, essential fatty acid imbalance, gut health, all these things that are foundational that can contribute to headaches. And lecturer and member of the Interdisciplinary Association of Functional Neurology and Rehabilitation. If you say it 3 times fast, you get to join. So look at that, still laughing at my joke. Good job, Alondra. So it's where different physicians get together and they go, how can we look at the nervous system and help it to recover? And this is what we do with functional neurology, chiropractic neurology. We see the brain a lot like a muscle, and so there's really some simple ways of thinking about it. It needs to be properly exercised, it needs to be properly nourished. And if we do that, then it grows stronger and more healthy. If we don't, then it grows weaker and more likely to dysfunction and all sorts of different neurological problems. So the reason we get such amazing results in our office is we have a different approach. So what's the different approaches? So you've got the medical community, about 97% of them, looking for infection, disease, and trauma. All right, that's like your medical neurologist, and that's good. We want people looking for infection, disease, and trauma. If they find it, then they use drugs or surgery to help resolve it. And that can be really helpful. It can be life-saving. I don't use drugs or surgery, so I look for what factors create wellness or health in your body and what's missing, what can be improved. Because no amount of focusing on disease is ever going to teach you how to get healthy. So that's what I focus on. It's characterized by this term salutogenesis. It comes from the Latin word saluto, which means health, and genesis, which is the creation of. Yeah. So it's the creation of health. So if we're going to, so we focus on those factors that create health, and that's how we get great results. It's pretty simple. Synergy is the combined effect is greater than the sum of the separate effects or the separate parts. So we combine nutrition and lifestyle, then we get some great results. They wouldn't if we just did one or the other. So there's mental, chemical, and physical. All right. Focus of time and money and effort leads to different information products and services. This gives you a way to think about the healthcare system or the medical system. So who is it that's focusing their time, money, and effort, and what is coming out the other end? So if it's a manufacturer, they're looking at stockholders, right? They're like, we've got money that is on the line, and maybe they want to serve mankind too. Maybe they actually have a really good purpose. But certainly we have to make money, and we need to serve mankind. And so that's what your manufacturer is looking for. And they may not, they may have other less, they may have those flipped, right? They're like, money, it's really mostly about money. And if we serve mankind as an accident, then that's okay. But really, we're here to make money. Others are like, I really want to serve mankind. And yeah, we need to make money to keep it going, but it just depends on the priorities, right? What is their focus? And then we look about doctors, right? Maybe they are management or insurance is telling them what they need to do, how they need to spend their time, how they need to focus. The patient interests, right? What do the patients want? And they have families to feed as well, so the money is a factor there as well. So where is their focus? Where is the balance of their focus? And typical patient or consumer, they're spending money, they're spending time, and they want immediate health and comfort, and they also want long-term health and comfort so they can enjoy their life. So where's the focus, and what does it lead to? At least some kind of solution, hopefully, but it's serving whose needs, whose focus. So keep that in mind as we evaluate where you're getting your information from. There's no shortage of information anymore now that we've got the internet and it's loaded with stuff. It used to be Wikipedia was it, and now Wikipedia is just a small little portion. So there's lots of information, and it's getting harder and harder to find out where it's coming from and who it's serving, right? So that's why we do these informational talks, so you can get the information straight from us. So you could do nothing, but that may not be an option. So what if you do nothing? You just keep suffering with it, or you keep taking the medications that you're taking and okay, I'm just not going to address the cause because I'm feeling good enough, because it's just too hard. Well, Journal of American Medical Association in 2004 said some patients with migraine with and without aura are at increased risk for subclinical lesions of certain brain areas. That's brain damage. So migraines can cause brain damage. Any history of severe headache was associated with an increased volume of white matter hyperintensities. That's from the British Medical Journal. What are hyperintensities? That's brain damage. Women with migraine have 150% increased stroke risk. So doing nothing may not be a good option. It's not like, as long as I can deal with it. It's like, no, there's a good chance that your brain is actually being damaged with migraines. It's interesting how close migraines are to a stroke. They're not quite, but they're almost like a mini stroke, like a transient ischemic attack. The traditional medical doctors rarely mention solutions other than drugs and surgery. About 97% of physicians, and just so you know, I made that statistic up, but it's fairly accurate, I think. They're looking for infection, disease, or trauma. Again, that's not bad. We just have to recognize what is their focus. Their focus is disease, infection, trauma. And if they don't find anything, then we celebrate, right? I don't have a disease. I'm going to live for a while. Now I can go to somebody who focuses on wellness to actually get me better. All right. But if you're looking for a wellness solution to a chronic problem, disease focus does not lead to wellness, all right? So it's like using a hammer to hit in a screw. You need a screwdriver to get a screw in. It's not complicated, but it does take the right tools. So we combine knowledge of multiple causes and solutions. So by using dietary, nutritional, lifestyle, and biomechanical treatments, there's up to a 95% chance that your headaches will hurt less, hurt less often, or perhaps go away completely. So where do we get that number? I did not make that statistic up. So that comes from different research, combining it together. Really, there's so many ways to get rid of migraines. I've got a list, and I'm going to give you a lot of that list tonight, and the ways you can apply it to yourself. A list of ways we can get rid of migraine. Everything from the effectiveness of high-dose riboflavin in migraine prophylaxis, oral magnesium, spinal adjustments, food sensitivities or food allergies. There's lots of things, and they all help a portion of the population. And so what we try to do is figure out what's going to help you. That's why we do our evaluations, so we can figure out, okay, what's the best solution? And I usually don't get very far on my list. And sometimes that's disappointing for my list, but it's really great for the patients because they get better before I've tried everything. Okay, so nerve irritation, we talked about, that's what causes your symptoms. So how can we reduce nerve irritation? Well, these are all the things that contribute to nerve irritation. The chemicals, joints, posture, mental, emotional, those are all causes of this brain irritation and nerve irritation. Here's another way to look at it, and we're going to go through these. Rebound headaches, ergonomics, muscles, joints, neck curve, mental stress, and nutrition. So let's talk about rebound first. So what causes rebound headaches? Well, here's a list put out by an organization called Migraine Again. So the medication classes and frequency of use that can lead to migraines that are caused by these rebound headaches. So non-opioid analgesics, what is that? Like acetaminophen, NSAIDs like aspirin and ibuprofen, more than 15 days per month can lead to rebound headaches. Combination of analgesics with caffeine like Excedrin migraine, greater than 10 days per month. Opioids like Fioricet and Escic, not familiar with that one, greater than 10 days a month. Isn't that interesting? These opioids and these analgesics with caffeine, and we think, oh, this is not near as bad as an opioid, and in many ways it's not as addictive, but using it the same amount seems to cause headaches. Triptans like sumatriptan and others, greater than 10 days, and in any combination of the above, it hits the lowest amount. So your medication may be causing your headaches. All right, what about muscles? And this goes into ergonomics as well as muscles. So toxin symptoms in the shoulder, arm, hand, neck, head. So poor posture or just long-term not moving, right? This guy's got great posture, but if he sits there for 4 hours, he's going to be toxic because the toxins build up in muscles that don't move because the muscles are working, but they're not able to contract and relax and get those toxins out. Those natural, in this case, we're talking about natural toxins produced by the body, just natural waste products. But also, it builds up if you don't have good food, air, or drink. You have joint malfunction, subluxations in your spine. We'll talk about what those are. Lack of motion, that's this guy who's not moving. Postural strain, that would be if you've had bad posture. Maybe the, so I'll make the picture bigger so you can see me here. So if this guy's seat were a little lower, his keyboard was up here, and then he had to raise his shoulder just a little bit to get control of that mouse or keyboard. It wouldn't feel like a big strain, but when you do it for a long time, then there's tension in the muscle. It's like the muscles are holding their breath, and so the waste products build up, and then it starts to radiate that irritation up into your head or down out into your arm. And then mental stress. That causes us to tighten our traps. People say, oh, I hold my stress up here in my shoulders. It's like, yeah, you and the rest of the world too. So that happens to all of us. Okay, so here's a little checklist for your workstation, ergonomics. So fit your workspace to your body, not your body to your workspace. Your chair. First thing you do is start with your chair, even before you get up to your desk. So move your chair away from your desk, sit in it. Your legs should be about 90 degrees or perhaps a little angled down, but not angled up. keyboard and mouse. So then you roll your chair up to your keyboard, and you should have should be able to drop down straight here. He's got a little bit of an angle, may not be a problem, but best if it's straight down, and then a 90 degree or so. It could be a little bit angled down here, but you don't want it angled up. So it's keyboard and mouse. Your screen. So you want the screen to the top 2/3 about where your eyes are, straight out from there, and about an arm's distance away. All right. Your job. What do you do in your job? So are you up and down? Do you use 10 keys? Do you work with documents a lot? Are you on the phone? So I won't go into all the details there. We have a whole nother presentation on ergonomics. But yeah, consider your job, and yeah, this is your ideal setup unless you're actually looking at documents. Most of the time you're not looking at a screen. So now you're down here like this or over there like that, and your screen's right in front of you. Well, you want your documents right in front of you, whatever you're working on all the time. Your environment, how's the sound, how's the temperature, how's the light. If there's a window back here, then he's having to squint, or there's a window behind him causing this light on the screen, and you won't often notice it until you turn the screen off. So you should do that. Turn it off, and then all of a sudden you can see stuff you couldn't see before. Yeah, so you guys can see me in there. Look at that. So, but if there were a bright window, or I were a bright guy, then you might see me reflecting more off of that. Yeah, so that's a great way to see if there's a glare. Because even if you see it here that's significant, then you'll see it. There we go. So if you see it when you turn the screen off significantly, then you're probably doing this kind of thing unconsciously. So be careful about that. Okay, so chair, keyboard, screen, job, environment. Move your body. Schedule movement. If you're not up and around all the time automatically, then you should schedule a little timer or something on your computer or on your phone or your watch. Say, hey, get up, move around, because sitting kills, moving heals. Sitting too much is really bad for your body and really bad for your brain. All right, muscles and joints, how can they contribute? Well, this is where we come back to subluxation and nerve irritation. So as chiropractors, subluxations are what we work with so much. And this really is the best solution for most people, and almost always an important part of the solution for migraines. So normally you have communication between the brain and the body. And that's good. So the brain is communicating. The nerves go through the spinal cord, which is inside the bones of the spinal column. And the nerves go out to organs, and then they come back to the brain. But a subluxation is spinal joint dysfunction that then interferes with this communication between the brain and the body. And so then the body's not happy, it's not getting the control it needs, and the brain's not happy, it's not getting the information, the stimulation it needs. So nerve interference or irritation matters because the purpose of the nervous system is to enable you to adapt to stress. And if you're not adapting to stress, then you can't be fully healthy. That is the definition of health, is adapting to stress appropriately. So subluxations are caused by stress, physical, chemical, mental, emotional. It's defined as a spinal joint problem, right, causing nerve irritation. And it often is silent, unless you're like in a car accident or something. It begins silently from these little traumas, little posture and strains and little accidents. And then eventually it leads to symptoms and conditions like migraines. So this is really interesting. I'm going to teach you something super cool here. So nerve irritation. Remember I said it's nerve irritation is the issue, nerve irritation or brain disturbance. So this is your brain, this is your brain stem, this is where your neck begins. So the cervical spine, right? And these nerves, C1 through 3, sensory nerves, they receive information from the back of your head and the top of your head, okay? And they come down in there and then go into your cervical spine and your spinal cord. But the trigeminal nucleus, trigeminal is cranial nerve 5, and it deals with your face. But that nerve also goes in to your meningeal nerves. So, do you have nerves? Can you feel your brain? What do you guys think? Can you think you can feel your brain? If somebody opened up your skull and started poking around without electrocuting or cutting anything, just kind of touching, could you go, oh wow, you're touching my brain right up there?
If there's nerves, yes.
If there are nerves, but they're actually not nerve endings. There are nerves, but they're not nerve receptors. So it's kind of a tricky question, right? There are nerves? Yeah, there are nerves up there, but there's no nerve receptors. So your brain doesn't know that you're touching it. But you can, where do you get headaches from? Well, it's this meninges. So up here, this meningeal nerves, they go to all your blood vessels and some other tissues. And so you can feel stuff in your skull, but you can't feel your brain. Okay, subtle difference for most of us. But the cool thing is these nerves go to your face. They all come back down, and they're in the trigeminal nucleus, which is also shared with C1 through 3. And so this is how your neck, this is why proper function of your spine is so critical, especially the upper spine is so critical to head comfort and getting rid of migraines. So we might feel pain in the eyes or pain in the head, and they can all come from this area here. All right, I'm going to tell you a migraine story about a patient. So this is from Tiffany. I think you guys read this one. Want to read one of these?
No.
Okay. You want to read one? All right. So I'm putting some people on the spot. See if I can read. Okay, you get to hear me more. My migraines started in December 2011 when I was missing so much school and I had to give up sports. In February 2012, I spent 4 days in Valley Children's Hospital on IV meds that were supposed to help. I threw up all night from the meds. I had a total of 5 days with no migraines though. 2 days after being released from the hospital, my migraines were back. I spent most of the time in bed sleeping with blankets over my head. I missed out on so much of my 6th grade school year. This is around 6th grade going through all this. We had spent so much money looking for answers. Doctors pretty much gave up on me. We heard about Dr. Hobbs and came in for an evaluation and treatment. Within a couple weeks, my migraines improved. It was amazing. As of today, I had only 3 migraines in 6 months. At first, I came in 3 times a week. Now I only need to see Dr. Hobbs once a month. I'm now able to read a book without getting lost and having to reread it. So that was, were the migraines doing it? Well, partially, but she was also having some other brain dysfunction. I have improved in proficiency and recall in reading, and I'm getting better grades in book tests. Also, back to playing sports. Before coming to Dr. Hobbs, I was on so much medication. I love Dr. Hobbs and don't know where I would be without his treatments. Dr. Hobbs and his staff are very nice and caring. I referred 3 people to see him. I can't say enough good things about them. Tiffany Jones. So that's super cool. Tiffany was super fun to get her better. Yeah, I just love getting people better because they can get back to their life. It's not about getting treatment. It's about getting well so you can do what you need to do with your life. All right. What about neck curve? Well, I'll tell you a story about a 5-year-old girl. She was diagnosed when she was 5 years old with migraines, but she was actually diagnosed a year before. I think the doctor just down the road from us gave her a diagnosis of migraines. Wow, at 4 years old, that is crazy. And I did an x-ray of her. She had a near total loss of her neck curve. And so normally you should have, there's curves in your spine. So let me get a good perspective here. Okay. So you should have a curve in your neck that goes this way, and a curve in your upper back. There we go. Curve in your neck that goes this way, and then a curve in your upper back that goes that way, and then a curve in your lower back that goes back the same curve as your neck. All right. So she had almost no curve in her neck, straight. All right. Did an x-ray, started working on restoring that curve, doing adjustments, and in 1 month, she got a curve back. That was pretty amazing. So we get restoration of curves regularly, but almost never that fast, that big. It went from like 0 to 25 in 1 month. It was amazing. But more importantly to her parents, she no longer had migraines. Super cool. Why could a neck have so much impact on migraines? Well, now you know, because all those nerves that come from your brain, those nerve receptors in your blood vessels and meninges, they come down and they actually go into the trigeminal nucleus, which is in your neck, which is also shared by other nerves. They go up to your head. So if we get those nerves working better in the spine, then we reduce nerve irritation, which is the cause of these migraines. All right, so I'm going to teach you a way to evaluate not just migraines but headaches. Where are they coming from? This is a cool little thing you can do on your own. Find the combination for your headaches. What's causing them? So start with where's the pain? So if the pain is in the temporal or the entire head, temporal region or your whole head, then if the answer is yes, are those muscles tender? So muscles in your jaw, muscles in your temporalis muscle or suboccipital muscles, are those tender? Also, we have in the upper trapezius, which is the area out here, right, your traps, especially where they, out in this area here near your shoulder, along the ridges of these bones. And okay, so are those tender? If the answer is yes, then you have muscle toxicity because that's what makes them tender. It can be related to stress or joint related. And as you find these areas, if you have a headache presently and it makes it better by massaging these areas, that's a home run. You know that's almost entirely the cause, right? At least the initial or that last step of the cause. And then working to clean out those toxins is going to be helpful to reducing your headaches. And if you don't have a headache and you massage those areas and it starts causing a headache in the area that you normally have one, same thing. There's a really good chance that's the cause, and then getting rid of those toxins is going to be helpful. What about no, it's not tender? Oh, I have a headache in those areas, but there's no tenderness. Well, you may have food sensitivity, systemic inflammation, deficiency, toxicity, or it could be rebound headaches, which is that medication issue, right? Okay, what if the headache is in your suboccipital area, right, just below your skull? It can be on one side or maybe both sides. Well, if it's one side, it's probably joint dysfunction or ergonomics, right? So maybe your hands up too far when you're working on the mouse or the keyboard. Muscle, joint, and nerve are all three involved in this case. Some people say, oh, I don't know if you think it's a bone or you think it's a nerve. It's like, if you've got a problem with your joints, especially in your spine, then you have problems with nerves. And if you have problems with nerves, you're going to have reactive muscles. So the answer is yes. All three are involved, almost always. If it's both sides, well, then you're thinking more about stress, but it could be your neck curve or ergonomics. So it can be the physical postural stress, or it can be emotional stress, then causing muscle, joint, and nerve irritation. Okay. One more area. What if it's around your eyes? Called it orbital. This guy looks like he's going scuba diving. So, well, you check, are your sinuses tender? How do you do that? So you have one frontal sinus or two frontal sinuses up here. Is it one or two? Honestly, I don't know. But you can just press this area up here. And then your maxillary sinus is right here. So, and you give them a good pressure. So what's a good pressure? More than it would take to squish a grape. Think of maybe a little chunk of cheese right there, and to squish the cheese. That's a good pressure, all right? But it doesn't matter. You can press super hard if it's not, right? So you can press super hard. How hard? Super hard? I don't know. A lot harder, like 5 or 10 pounds of force. Right? Probably 10 pounds of force. It shouldn't hurt. I mean, it may just be a little bit of bruising on your, but it shouldn't hurt. So you compare it side to side. It's like, oh yeah, it's tender over there, but it's not over here. Anyway, that's a good way to find out if it's sinuses. If you got that buildup of sinus pressure, it's like, oh, that could be a sinus headache. Well, I gave it away. Sinus or allergies may be involved. What do we do for that? Well, adjustments, again, can help because that gets the nerve working better. We also have, your sinuses need proper bacteria. There's supposed to be bacteria in there. And if you ever use steroid sprays or other stuff, then that can get rid of those, and then you don't have proper bacteria. Probably diet affects it as well. But just like your gut needs normal bacteria, your sinuses need normal bacteria. And so the one bacteria that's often missing from people who have chronic sinusitis or allergies is called Lactobacillus sakei. It's the same bacteria that they use in making sake beer. Yeah, that's kind of weird.
For allergies?
So you should sniff beer for your allergies. No. I don't know how they figured that out initially. Maybe someone was sniffing beer. And it's like, hey, my allergies are better. It's like, I think I'll do that regularly. But anyway, that's, yeah. So anyway, so we don't sell beer, but we do sell the little Lactobacillus sakei. Okay. What if no, sinuses don't hurt, but this pain is in this area? Pain after reading for a long time in any position. So certain positions can cause headaches because you're like reading on your stomach with your head bent up, or other can cause it. But it's like after reading for a long time, or being in school and looking at the chalkboard or something, then maybe you've got, maybe you're farsighted. You need glasses. Okay, so you just get your eyes checked to find out. And what if your jaw muscles are not tender? So what is that? We went back to here, right? So if these are tender, because your jaw muscles, are they tender? Because if they're tender, they can actually radiate pain up into your eyes. So that's really common. Or even your sternocleidomastoid. I don't have that on there, but that one can refer pain up too. So it also can come from your suboccipitalis muscles, but any of those areas, if they're tender, then you have muscle toxicity. It can be stress-related or joint-related. All right, so pretty cool. Take a picture of that. You can check your own headache and check the headaches of your friends. You can now be a doctor. Because you're looking for causes, though. But what's the solution? Well, if you have a rebound headache, I'm not going to read through all this, so you guys can go back and look at this later. But you wean off the caffeine and caffeinated medications. Ergonomics, fit the workstation to the worker. Reduce the strain, irritation, and injuries. Muscle toxicity, massage or trigger point therapy. You may need chiropractic if joints are contributing to the muscle tension and irritation. Stress, like emotional stress, improving events and or perspective, which is your view of the situation. Often it's not the stuff that happens to us, it's our view of what happens to us. It's our perception, our perspective. And if we can change our perspective, then we don't get as worried or stressed about it. There's a great book. It's called How to Win. No, that's another book by Dale Carnegie. This one's called How to Stop Worrying and Start Living. How to Stop Worrying and Start Living. I don't know if it's written 30, 40 years ago. I think I listened to it on CD, or maybe I've also listened to it on cassette tape. It's been around a while. So have I, apparently. One time I was driving and I was listening to it, and I was so enthralled by this, I missed my turnoff by 2 hours. That was great. So I was into that book. So it's a great book. All right. What are the 7 synergistic steps to healthy nerves, muscles, vessels causing head and neck pain? Find the cause. That means we do a test, we examine, find out what's going on. Decrease dietary interference. This would be like food sensitivities. Increase dietary healers, good fatty acids, an adequate amount of protein. Also, dietary interference could be blood sugar spikes. Supplement is needed. Restore body neurology and structure. It's chiropractic adjustments, posture. Move and use your body correctly. It's exercise. That's ergonomics. And then we reevaluate. So let's see what's left over. We clear away all the easy, big stuff, and then we come back and go, okay, I'm still having headaches, not as often, but I'm still having them. It's like, okay, what's left? We do a deep dive a little more and find out what's going on. Make this so you guys can see that better. All right, professional need for headache. So if it's joint or nerve dysfunction, chiropractic adjustments, and reducing the cause. Neck curve, corrected by chiropractic adjustments and home therapy. Food sensitivity, inflammation, or dietary deficiency, deficient or toxicity. supplementations, and the 4R intestinal healing program, and dietary changes. All right, 2-minute, 10-question healthy brain self-diagnosis. I'm not going to read through all these, but it goes through a lot of the things we just talked about. Exercise, mental stress or relaxation, sleeping 7 to 9 hours, not smoking, not hanging out with girls who do, eat fat food less than 2 times a week, eat and drink, etc., etc., right? So you can give yourself a score, and then there's scoring on the next page. See, I'm going to flip it so you guys can see the whole screen. All right. And then the next page is our scoring. 35 to 22 is actually pretty good. That's pretty generous scoring, but not bad if you're doing that. Now, if you've got, if you have active brain, like dementia or something, so I'm trying to get the screen where you can see me. There we go. Okay. If you have dementia or something, then we'd have to be we have to be more aggressive with this, because this would not be adequate probably to improve, but it's a good place to start. And then what do? Well, then you correct what you eat, drink, breathe, think, sleep, and move. All right. Goes through the same things again. Same thing we had in the questionnaire. Here's the solutions. I'll give you a close-up of that. And then what do we do when you come into the office? What can you expect? Part 1, history and neuropathy severity, and other nerve irritation there is going on. In this case, we're talking about headache, migraine severity, spinal screening. So we ask about your symptoms and your history. What have you tried? We're not just going to go, oh, it's the same for everybody, so let's put you in this canned program. We're going to ask what's going on with you. What have you done? And often I learn quite a bit from that, so then I can help you be more efficient, because that's my job, is to give you ways to be efficient in resolving your condition. All right, so I am going to ask you to work. I'm going to ask you probably to make some significant changes, but at this point, already migraines can ruin your life. They're interfering with your life. So you're already working really hard just to survive, just to live, certainly not to thrive. So I want to give you action steps then that can help you to thrive. So we take a step, it actually gives you progress instead of just peeling out and trying not to lose ground. Now we start to make progress, and if you have a little progress, that means a little less pain, a little less often, a little less severe, and then you're like, okay, now I've got a little more to work with, and I can make another step and another step. All right, so we check out your spine. We talk to you. We check out your spine really well, because now we know how much important the spine is in contributing to head brain function. And we'll also do some additional history. In this case, treatment, trauma, recovery, whatever's gone on. We'll do other neurological testing, including your autonomic nervous system, because that's what controls blood vessels. We might check your balance, check your posture, might check your arches in your feet, because that's the foundation. We might do an x-ray. If you have a lost curve in your neck, we need to know that. And then we'll give you results. We'll go over it with you and say, what did we find and what can we do about it? And then we'll do an adjustment typically, or some kind of a therapeutic trial, and see, okay, what kind of impact can we make immediately? We want to see what kind of changes we can make. And then we might do functional lab testing. That includes looking for all those deficiencies, toxicities, leaky gut syndrome, food and chemical sensitivities. All right. And so typically this costs $275, or if there's x-rays, it's more. So what we do for the seminar price is $145. And so that's so if you're dealing with this, we want to give you an opportunity to just find out if it's something we can help you with. So we do all that. We don't do the lab testing for that amount. It doesn't include lab testing, but everything else, including the report, including the first adjustment, to see if we can help you. And if we can, then we'll come up with a plan for you. So what do we typically do if someone is needing treatment? Then what do we do? So often it's twice a week initially, and we may do lab testing for those things we talked about, and that involves a finger prick blood test and urine sample and often a blood draw for the chemical sensitivities. So we do this with children, and we do it with older people as well. We really find out what's going on. And then if we found problems structurally, which we usually do, then we do adjustments. That's the twice a week. We may do muscle work. We'll give you ways to help yourself at home. And so we usually will go for about 4 weeks at twice a week, and then we go down to once a week, then we go down to once every other week. And yeah, you just get better and better and better, even though we're seeing you less and less and less. And that's the goal, to get your life back. This is what one of the lab tests look like for the deficiencies of different nutrients. And that's the end. So if you'd like to take advantage of this seminar pricing is available for the next 2 weeks. So right now we're looking at March 26, 2026. So for the next 2 weeks, if you call in, make an appointment, then you'll get that price. And let's say you got a whole family, because if somebody's got migraines, it's not just a stress on you, it's a stress on the whole family. So we'll actually give you a price for $245 for everybody in the family. So that's not for each member, that's for everybody altogether. So yeah, we'd be happy to help you out. If you have any questions about any of this that I've gone over, then give us a call, email, or text us, and start applying some of those things you learned tonight, because I gave you a lot of action steps. All right, have a wonderful day, and may God bless you.